Welcome everyone to episode 3 of the Rehab Revolution, where recovery meets revolution with Dr. Gariffo. Episode 3 today, we're going to talk a little bit about breaking through the psychology of pain and recovery. On today's episode, we're going to explore a little bit about the psychology of pain and how our mindset influences recovery. Dr. Gariffo here, who is the expert, who will be talking to us a little bit more into depth with this episode. So how are you doing today, Dr. Gariffo? Are you ready to talk to our listeners?
Let's go. Yes. I'm really excited about this lecture today. Phase
Absolutely.
3.
So am I. So we'll jump right in with some questions that I have ready for you. Dr. Gariffo, I know that we've previously talked a little bit about this, but pain is such a personal experience. Have you ever had a moment in your own life where you feel that you've actually had to fight through pain yourself, either physically or mentally?
Yes. Great question, Layla. So, that experience, and I'll get into it, really gave me a new level of empathy, if you will. So for me, as a doctor of physical therapy, pain is deeply personal. I see it every day. I just saw a patient an hour ago and how it shapes their lives. I mean, really shapes their lives physically, not just physically, but also emotionally and mentally too. My guide and my role is to absolutely guide them through their pain. I've had my own battles with pain as well. So in 2020, I was training for the Dopey Run. I'm not sure if you ever heard of the Dopey Run. I'm not sure if you know what that is.
No.
And one moment in that training stands out as a major injury I sustained during my own training. So the Dopey Run, just as a catchment for that, is a 48.6 mile run.
Wow.
Over 4 days throughout Disney World. So you go there Thursday, Friday, Saturday, Sunday, and Thursday you're running a 5K, Friday you run a 10K, Saturday you run a half marathon, and Sunday you run a full marathon. And I completed that in 2020. But that was through an injury. I've always been active my whole life, pushing through overuse injuries, forced me to confront the same frustrations my patients experience. The struggle of wanting to push forward when your body's telling you to slow down, or try to finish that marathon when your body's like, you got nothing left in the tank. You need to stop running. That's a mental challenge. It's not just intense physically, but it's also intense mentally. It took a lot of patience, a lot of humility, a lot of shift in my mindset to listen to my body rather than fight against it. So I was able to walk through a portion of the marathon, but I got through it because I listened to my body. And like I said earlier, that really gave me a new level of empathy. It's not about the tissue damage or the diagnosis. It's about the fear, the setbacks, the uncertainty of the injury, and how do you deal with that? I find that it reminded me that the healing really isn't linear. Having done this for 30 years, the hardest part of recovery isn't the physical rehab, but most often it's the mental resilience it requires.
Absolutely. And I could imagine running 48 plus miles in 4 days must have been an extreme challenge. And you mentioned it was in Disney, so I'm assuming very hot as well.
Yeah, it's funny. So the 5K on Thursday morning was 50 degrees, okay? So I had full winter gear on. Now, Sunday, the full marathon was 91 degrees. So I had people in front of me collapsing, stroking out, in an ambulance, laying in the grass, throwing up. It was brutal experience. But like I said, the mental resilience got me through it. Not just focusing on why my legs were hurting, why my feet were hurting, why I felt nauseous, but I understood my body. I respected my body. But sometimes the body lies to you, and sometimes you mentally have to get through it. So it really taught me a lot of empathy for my own patients.
Absolutely. And that's such a drastic change from 50 to 90.
It's impossible to train for that. You're cold and then really, really hot.
Yeah. And you said your resilience, was there something specific that you were thinking while you were getting through it? Or was it more of a feeling of you just need to keep going?
It's interesting. So my dad passed 2 years prior. And for me, it was like a prayer to him throughout the run. Like, Dad, just got to get through this. Just got to get through this. And there's a really interesting picture of the finish line where the Epcot ball is behind me, and they shot a picture of me, and it's on Disney's website, of me finishing the marathon and pointing up to him and praying to him and thanking him for that just really finale of getting through the journey. The past mile, the last mile was the most horrific mile of my experience. But by just confiding in him and having the resilience to get through it, he got me through it.
Wow, that's such a beautiful, beautiful sentiment. And I love that it was somehow photographed and ended up on the website.
I'll share that picture with you at a later date.
Great, because I was going to look for it after this anyway. I need to see that.
I'll send it over to you, absolutely.
That's definitely such a beautiful, beautiful sentiment. I love that. And kind of touching on that, I know we often hear things like pain is all in your head. But scientifically speaking, and what you just touched on, how much of pain is actually physical and how much is mental? And do you think there's an answer to that?
You know, that gets to the heart of really how we understand pain. And when you look at pain, pain is both physical and mental, not in the way that phrase states that pain is all in your head. That's often misunderstood, even though it is biological, which is physical, physiological, which is mental, and social, which is environmental, but it's all intertwined. And that is often referred to the biopsychological model of pain. And within that, you have the physical side of pain, which is nociceptive tissue damage. So the pain reflex is a nociceptive, that's the term for it, that leads to harmful stimuli. And within that, you have injury, inflammation, and you have special nerve receptors that call that pain to the brain. And that's where the mental, emotional side comes into play around perception of pain and processing pain. The pain intercepts and interprets the signals from the tissue damage, from the trauma, and that it also takes into account the emotional part of the pain, meaning what is your past experiences of pain? What are your emotions right now? What's your stress level right now? And even your beliefs about pain. Some people just feel like I should not be in pain right now. I need to stop doing what I'm doing. That's why two people with the same diagnosis or the same injury can often experience dramatic different levels of pain. Conditions like anxiety, depression, fear, or past trauma amplifies that pain. So you have one individual with an ACL surgery and another individual, same age, same surgery, dramatic differences in pain and dramatic differences in rehab potential. And then that leads to the last bucket of pain, which is chronic pain, when that pain persists way past the injury date. And what happens is the nervous system with chronic pain is often sensitized to the pain, and then the neurological and the mental approach to pain gets confused, and the signal gets confused, and that's why it remains chronic until someone like myself can treat that appropriately. And then you talk about, is it all in your head? Are there ratios with that? I don't think there's any universal percentage as to the split is 60% physical or 40% mental, because like I mentioned, it really varies by individual, by type of injury, by emotional state. But research shows that there's a massive, massive role in shaping pain mentally, perhaps even more than the injury itself, which is physical. So leading me to, is pain all in your head? Absolutely not. But it is processed in the brain. So we can say that it's in your head, but it's processed in your head. That doesn't really make it less real. In fact, understanding how pain works makes it even more real as to how you treat it. So not only am I treating that patient physically with range of motion or strengthening or balance or pain relief exercises, I'm also approaching it with mindfulness or cognitive behavioral therapy or graded exposure therapy. Helps really rewire the patient's response to pain just as much as physical rehab does, and helps the body.
Do you think that has anything to do when people talk about pain tolerance? For example, like, oh, I have a high pain tolerance or I have a low pain tolerance. Do you think that phrase at all has anything to do with like the mental aspect of it?
I do, because like I mentioned, it's not just how I interpret pain or I am, I'm an elite NFL star and I'm injured all the time and I just have to work through the pain. Like I mentioned, the same exact injury that is physical has to interact with the emotional side, the past trauma, the depression, the anxiety, anything that patient may be going through that we're not aware of if we just look at the injury. So saying it's not in your head is not an accurate statement. Also saying that somebody has a higher pain tolerance, that simply means that my experience with pain, I was able to get through that pain level, whereas somebody that maybe it's like the same injury doesn't have the same resilience, doesn't have the same aptitude to say like, what level of pain is this, and kind of get through it.
Great. And I know in your practice, the rehab room, you have some staff that's trauma specialists. Could you walk through why you have those trauma specialists on staff?
Sure. So the bottom line really with our staffing is that pain isn't just physical. So treatment shouldn't be either. So when we look at a patient and they come in and I mentioned, the depression, the anxiety, the PTSD, that often patients come to me and they can't pick up their granddaughter anymore. Or they can't take a walk with their wife anymore because of the knee pain or the shoulder pain. So we believe that pain is never just about the body. It's an experience shaped by a person's history, emotions, stress levels, even past trauma. That's why we integrate trauma psychologists, LCSWs, which is a licensed clinical social worker, specialist directly into our practice. Because like I said, pain and trauma are deeply connected. Many patients come to me with chronic pain, post-surgical pain, injury-related limitations, but we often find that the underlying trauma, whether physical, emotional, or psychological, can amplify that experience of pain. You asked me earlier about, does somebody have a higher pain tolerance? What I find is that past underlying trauma often dictates how they experience pain. Trauma rewires, it really does rewire the nervous system altogether, making it more sensitive to pain signals. So if I had prior trauma to my knee 5-6 times, I had 3 surgeries, and this is your first surgery, my past experience with pain has a dramatic effect on my rehab potential. That's why traditional rehab alone isn't always enough. And that's why we're so unique in our approach here at the rehab room, where other big box stores don't offer what I offer around having a dedicated staff that's experienced with trauma, experienced with any kind of injuries or anxiety or depression. Really helps complement my practice, as well as reciprocal in that they may have a patient come to them that they're treating for anxiety and they say, hey, this patient has severe knee pain. Can you come check it out? So on site, we triage that patient before they even leave the building. And we have a diagnosis. Okay, you're here for the psychologist, but I want you to come in for an evaluation. I think you have a tear in your shoulder or you have tendonitis. So that really helps us complement the practice as well as helps us complement the psychologist's practice as well.
And when you do talk about trauma and how it can affect someone's experience, I'm curious to know if you think that it can be helpful or have more of a negative impact. So, for example, like you just touched on having, let's say you hurt your knee and you've had 6 surgeries versus someone who's having their first surgery or their first experience. Someone who's had more surgeries, do you think that this would be an easier mental thing to go through because they've done it before versus someone who might be scared that it's their first surgery? Does that like negatively or positively affect someone, do you think?
I think back to my experience with the elite athletes, soccer, NFL, Philadelphia Eagles, Philadelphia Union. And what you find is that I would say 90% of elite athletes at that level have had multiple injuries, multiple surgeries, multiple trauma, concussion, ACL rehab, etc. So what you find in that particular kind of like silo of patients, very, very small silo, because the elite is the elite for a reason. Oftentimes they suffer through frustration and anxiety and even depression when their injury prevents them from going back to what they do and what they love, meaning I'm a quarterback. I want to be a quarterback again. I just had shoulder surgery. And what I found is I remember one patient I had, and he had ACL surgery 3 times in his knee. And he was cut from the one team, and he was moved to California for another team, and then he was cut from that team, and he was moved to New Mexico for this final team, and then he was cut from there because of the injury. So this guy, his identity was associated with his sport. So when you lose your sport at that level, severe depression kicks in, severe isolation kicks in. And if you're not aware of that, or you don't have the ability or the experience or the expertise to deal with that, the psychological barriers to recovery, the trauma psychology, the stress management, that's what we do here. So that, to answer your question, what we find is that someone that has multiple injuries or multiple surgeries oftentimes can lead to even greater isolation than someone who's having a brand new surgery because it's so new to them. Whereas the person that had multiple surgeries knows what's expected for the rehab, but when they're moving on down the lane and they can't get back to their sport, oftentimes that patient responds with severe anxiety, severe isolation, because their identity is tied to the sport. Whereas someone walking off the street who had ACL surgery, oftentimes, I can't remember one time where their identity was tied to their sport for a 16-year-old or a 20-year-old basketball player or soccer player.
I could definitely understand how an elite athlete would completely tie those things together between them, their sport and their personality, and having that be such a dramatic situation for them. Whether it's an elite athlete or a regular patient that you've encountered, do you have any examples where you can think of a patient's mindset really making all the difference in their recovery?
Yeah, I think of a patient who became a friend. His name is Steve, and he was a police officer, and he was 38 years old, and he was restraining an individual who was being arrested, and he was trying to cuff him, and the guy turned on him and pinned him down, and in the process of doing that, he tore his ACL in his knee, and he tore his rotator cuff in his shoulder. So he had surgery of his ACL and his rotator cuff, and he came to see me. And what I found with him and treating him and meeting him and talking him through all this process is his biggest fear was, I don't think I'm ever going to get back to work as a police officer. And it ties in with the identity of an elite athlete, as well as somebody who has their own profession or their own career. So happens that he was a police officer, loved his job, wanted to get back to work as a police officer. And there was many, many roadblocks associated with that injury and that subsequent surgery around his battle of self-doubt, fear, frustration, discomfort, every twinge of pain he associated with the injury, the original injury. Like, hey, that knee pain that you're stretching my knee out feels exactly like it felt when I was trying to cuff that guy. So it was a mental roadblock, and I had to get him through that, had to teach him how to process through that. And how I did that was, number one, we reframed pain. Instead of saying, hey, Steve, this is not a setback. Let's talk about your discomfort and what your adaptations are and why you're failing, because you're looking at this the wrong way. And here's the right way to look at this. This is not a setback. This is merely a pain level that is I'm comfortable with as your doctor of physical therapy. If you're at a 4 out of 10 pain, I'm good with that. If you're at a 9 out of 10 pain, I'm not good with that. So we really kind of introduced that and reframed his pain. Secondly, what we did was we really introduced visualization techniques. Every day before he started therapy, we visualized himself moving through pain-free, lifting the weight, or climbing the stairs, or even running into a scene again, even running into a scene of he's about to handcuff somebody and then visualize that. And oftentimes the brain doesn't know the reality of an interaction versus a visualization of an interaction. And lastly, what we did is we really together tackled that fear head on. Instead of avoiding movements of the shoulder or the knee that scared him, we gradually introduced and reintroduced movement, proving to his brain that he was safe. So instead of aggressively flexing his knee, we slowly flexed his knee 10 degrees, not 40 degrees. Same thing with the shoulder. I took him through the range of motion, showed him that it's safe, showed him that the pain is a discomfort. It's not a stabbing, sharp pain of which we should be fearful of. And then one day, 4 weeks later, he walked in the gym. He wasn't dragging his feet. He wasn't bracing every time he moved. And I just said to him, I said, point blank, I said, Steve, what happened? I said, what changed? He said, I stopped fighting my body. I finally stopped fighting my body. I started trusting it again. And that was just game changer.
Absolutely. That sounds like a game changer. It must be super relieving for the patient and honestly super rewarding for you as well to see that progress happen. You touched on visualization techniques, which is cool. I haven't actually heard of that, but I know the one you touched on with him going back and being in that position to pin someone and arrest someone. Do you tend to create specific visualization techniques for your patient, like unique specific ones, or are there common ones that you tend to use or can use with patients?
Yeah, usually it's one of two things. It's either job specific or sport specific. So for him, it was job specific. For the elite quarterback in the NFL, it was sport specific. I knew exactly what he did every single time he was on the field. So we would, in rehab, of course, the physical rehab was majority of it, but the psychological rehab was, okay, close your eyes, lay down, and let's walk through what it looks like when you're on the field pre-injury. And you see yourself throwing that ball and your wide receiver catching that ball. You see yourself scrambling and not being fearful of your leg buckling. And then let's walk through that. Like I can walk through the auditory part of it. And then that person, that patient, that athlete can visualize what a successful day playing in the NFL was like. Yard by yard, play by play, first down by first down, into the end zone. So we did a lot of that with our advanced athletes as well as with our clients, for firefighter to a police officer to a postal worker, where we can visualize, okay, you walked 6 miles a day. What's that look like? Well, I gotta hop over the fence between different, delivering this mail, and I have to pick this big bag up. Okay, let's go ahead and do that. Physically, we're gonna load the bag to 45 pounds is what you tell me your bag weighs, but you're gonna visualize what it looks like to walk over that yard and have a healthy knee, even though you had surgery, and it's dramatic positive outcomes with that.
Yeah, that sounds like an amazing technique. I can see how that can definitely motivate someone to keep going. And maybe not this patient, but for other patients, or maybe the same one, I know it's common for patients to seem to, quote unquote, get stuck in recovery, even when their bodies are healing. What are some of the biggest mental roadblocks that you do come across with patients?
I feel that healing really isn't just a physical process. I know I said it 20 times already. It's a mental one. So some patients get stuck when their bodies are healing, not because of the injury itself, but because of the way their mind processes that pain or that movement or the progress. The biggest mental roadblocks that I see in my practice is fear avoidance, depression, and lack of confidence. And we'll just go down that path for each. So fear avoidance is the typical, if it hurts, I must be making it worse. Oftentimes, 95% of the times, that's not accurate. We see that's the most common roadblock in recovery. They're hyper aware of the pain and start avoiding certain movements that bring on that pain. Convinced that if that hurts, I must be damaging the tissue further. And why that happens is because of past trauma, catastrophizing pain, overprotectiveness. How we overcome that, we talked about reframing it, gradual exposure to the movement or to the sport or to the strengthening exercise, and educating the patient. So the patient wants to know, okay, what should I experience as my tissues healing, or my body's adapting, or I'm starting to trust movement again? I have a great example. I have an elite runner. She's 17, full scholarship, looking at all kinds of colleges, had Achilles tendon rupture. So that's the heel cord in your back of your ankle. And then just chronic lingering soreness in the ankle, particularly in the back of the ankle. So what we did, instead of going back to the running or the sprinting, we simply started with progressive introduction of light walking, light hopping, eventually slow jogging, and then that rebuilds her confidence in her body without overwhelming the nervous system. That's one way of, that we see that people are stuck, which would be that fear avoidance. And we talked about, the next one was that depression. I don't feel like myself anymore. Just had the patient today come in, total knee replacement, and we were talking about it. And what I see is why that happens is loss of independence, isolation, chronic pain, rewiring the brain. We talked about that. And then how we overcome that is this patient had a total knee replacement. So major surgery on his knee, new knee, big stitch on the front of his knee, 17 centimeters long. And he feels like, hey, I don't feel like myself anymore. I can't go on my walks with my wife anymore. He was here with his wife, actually. And we just talked about, like, okay, what does that mean to you? Like, by not walking with your wife anymore at night, what does that mean? Well, that's my life. I want to walk with my wife. I want to hold her hand. Okay, he's in a funk now. So we have to talk about not just the physical rehab, his range of motion, his strength, but also talk about, like, I felt and he felt that he lost his identity. He lost his identity as a man, as a husband. He couldn't walk with his wife anymore. So how we got back to that is just simply letting him know where he is 3 weeks post-op is where he should be. And he was so thankful for me telling him, hey, I've seen probably 1,000 of these knee replacements. Your knee looks phenomenal. You're well in advance of where you should be at 3 weeks. You look like you've been out 8 weeks post-op. And he was just so happy to hear that. He knew he wasn't hurting his knee. He knew he could go on a walk with his wife, of course, with his crutch, but it was just really a game changer for him in 10 minutes. And the last one is, I talked about lack of confidence. I don't trust my body anymore. They second guess every motion. They mentally remain injured, even though they're not injured anymore physically. And why that happens is because we talked about over-reliance on medical clearance or negative self-talk or past injury experiences. And how we could get through that is saying, hey, okay, you have the confidence anymore. Let's build that confidence up. An ACL patient, soccer patient, they come in, and instead of going back to cutting drills, we just do linear drills. So there's no fear of re-injury. There's mental imagery. We talked about that. Progressive return to play drills, structured. So the takeaway really is the mind really can be the biggest barrier or the biggest weapon. Depends on how you use it in recovery. The key is training it just as much as you train the body.
Absolutely. And it sounds like you definitely provide a lot of motivation for your patients as they're in rehab. Beyond providing that motivational encouragement, how do you help patients who are in those places of fear and pain, movement, and how do you help patients who are afraid of re-injury?
Yeah, I have a great quote that I use all the time with my patients. It's, fear is a liar, but you don't have to believe it. So when you look at the mental approach to injury, fear tells movement that it's dangerous. So fear in my head of movement says to me, there's a direct correlation between this being dangerous because it hurts. If it tells you to stop, even when your body is ready to heal, that's a lie. So how we do that, how we get around that is that fear becomes one of the biggest barriers to rehab. Fear of pain, fear of movement, fear of re-injury. Fear can be retrained just like the body. Step-by-step toolkit to help my patients get through and regain the trust in their body. How we do that? Talk about it again. Reframing the pain. not all pain is bad. Instead of thinking, this hurts, I must be making it worse, this sensation in my body is adjusting, and that's okay, is the reframing of it. Start small, gradual exposure to movement. Introduce movement in small, controlled steps. Example, patient comes in, has an ankle injury, walking, then slow jogging, then short intervals of running. Back pain patient, back surgery patient. If bending forward scares you after back surgery, let's start by hinging at your hip and slightly at the hips, then progress down, touch your thighs, touch your knees, and eventually your toes. So it's not just a full flexion of the lumbar spine, it's a graduated, kind of like slow introduction to movement again. And then really, really great approach to managing pain and managing fear of pain is this traffic light system for pain. So whenever I'm stretching out a patient or we're going through some strengthening or aggressive stretching, I say, okay, here's the green light, yellow light, red light. And we're going to talk about this every time I'm touching you. Green, safe pain, mild discomfort. Let's keep going. Yellow, caution pain. Modify the movement, but we're not going to stop. Red, stop pain. That pain is sharp, it's shooting, it's severe. Let's pause and let's reassess. Not going to stop, but let's pause and let's reassess. Let's talk through that. That's the great example with my total knee replacement patient where I was able to successfully talk to him about his pain. Yellow pain's great, green pain's great, red pain sometimes is great too, but we're going to reassess every time you're in red pain. And then shift the focus from fear to strength. Instead of obsessing over what might go wrong, let's focus on what's already going right. That's a tangential mind shift. At the end of the day, let's write down one thing that your body did well today. Let's not talk about the pain in the knee and I can't walk and my balance off. What did your body do well today? And every time I see a new patient or they come in the next day, okay, tell me what you wrote down last night. A chronic pain patient often learns to celebrate small mobility or strength gains rather than focusing on every single painful movement.
It definitely sounds like the small movements are what really help to rebuild that confidence, right? Absolutely. And then I feel like it would be helpful for patients to, instead of focusing on this one big thing that seems maybe far out of reach or impossible or hard at that moment, just being able to check off those smaller things would provide a level of confidence in themselves. So I think that that's great. Absolutely. And I will be quoting you on "Fear is a liar. You don't have to believe it." That is a great quote that I am going to incorporate into my regular everyday life.
All right. I love it.
I like that one. And I know you did talk about some of these techniques, but what are some other techniques, if any, like visualization, mindfulness, or breathing that help people and your patients rewire their pain response? And there's some of these techniques that people who may be listening can use to rewire their pain response.
Yeah. We talked about how pain is trainable. It really is trainable. You can train how your brain interprets pain. Here, I love the third, but I'm going to go through the first two rather quickly. So we talked about visualization. What does that mean? It's shifting the elite athletes use it all the time. The brain really can't tell the difference between real and imagined movement. Mindfulness, shifting your attention away from the pain. Observe pain without reacting emotionally. That's where you walk them through. Focus on your breath without judgment. Redirect your attention to something neutral. And then my favorite is, and I do it every morning. I do 3 bouts of 30-second holds every single morning. Diaphragmatic breathing is very important. Box breathing, etc. So our bodies are meant to either fight or flight. That's the amygdala. That's being hijacked every time we're in pain. It heightens our body's awareness of the fight or flight response. Deep breathing, diaphragmatic breathing shifts the nervous system into relaxation mode. That is 100% accurate. Like I said, I do it every day. It reduces tension and it reduces pain sensitivity. Box breathing is simply breathing in through the nose for a count of 6, holding that breath for a count of 6, breathing out for a count of 6, and holding that exhale for a count of 6. Navy SEALs do it in training. Navy SEAls do it when underwater. So it works. And the other one that works really well is body scanning. I'm not sure if you ever heard of body scanning. So what body scanning is where tension makes the pain worse. So what we do is we identify and release those painful areas. Let's give an ankle patient or a calf patient as an example. So we have the patient lie down and we want to bring the awareness to their toes. Are they tense? Okay, let's relax that. Let's slowly move up the chain here. Let's move to your knee. Let's contract that knee. Let's relax the knee. Moving up to the hips, to the back. Consciously relieving tension in each area is releasing the subconscious muscle tension. And the last one is positive self-talk. So rewiring the pain's narrative. If you constantly tell yourself, I'm broken, this will never go away, I'm scared to move, your brain will 100% amplify that pain signal instead of training your brain to expect recovery. As an example, I trust my body to heal. Every day I get stronger. I am more than my pain. And research shows that positive self-talk reduces fear and really retrains the body's and the brain's perception of pain.
Absolutely. I'm sure that previous patients that you mentioned, like Steve and the 17-year-old girl, incorporated those as well as visualization to really see the progress that they saw. And I know beyond these techniques that you do use, you work with a lot of innovative treatments, like dry needling and hyperbaric oxygen. How do these therapies also help to reset the brain's pain response?
It's sort of like, if you look at it this way, therapies matter in the modern rehab, at the rehab room. And it's unique in that I'm proud to say I am the only hyperbaric oxygen therapy provider in the tri-state area. I'm one of a few board-certified dry needling experts in the tri-state area. What I found in my 30-year career is that big box traditional rehab doesn't usually, if ever, address the nervous system's role in pain. And that pain often becomes chronic. It's no longer about the injured tissue anymore. It's about that overactive pain response in the brain, in the nerves. So at the rehab room, by integrating treatments like HBOT, hyperbaric oxygen therapy, dry needling, we're not just treating the symptoms, we're really actually rewiring how your brain and body processes pain at the neurological level, because these treatments are working at the neurological level. Hyperbarics, dry needling, all supercharging your body's natural healing response and your natural healing ability. So, for example, hyperbaric oxygen therapy is pure oxygen in a pressurized chamber. Dramatically increases oxygen delivery to the tissues, nerves, and the brain. There you go, to the brain. So by doing that, it resets the pain response, it decreases inflammation, it heals damaged nerves, and it rewires the brain. It helps the pain processing centers in the brain deal with chronic pain, fibromyalgia, post-concussive syndromes. I had a patient come in last night, 13-year-old, cerebral palsy, autism. He's going to come in for hyperbarics. Because of why? Because of brain recovery, because of treating the brain and the nerve tissues associated with autism and cerebral palsy. Bottom line of hyperbarics is that it really does reboot your response of your system to reducing inflammation, to repairing nerves, and to normalizing the brain function. Dry needling is a game changer. It really is in this profession. Like I said, not many people are offering it. I'm board certified in it, and I've seen amazing outcomes with my wife, with treating my sons, with treating a patient who has ACL surgery, to a patient that has post-concussive syndrome. Again, dramatic results. And oftentimes, dry needling will be confused with acupuncture. It's not acupuncture. Acupuncture is based on the energy flow, the chi, if you will, throughout the body. Dry needling is rooted in neuroscience. It directly targets those dysfunctional muscle fibers, trigger points, and nerve pathways. How it resets the pain response is it releases overactive muscles, and then it decreases that constant tension in the muscle and the guarding in the muscle, and resets the muscle. It interrupts that pain pathway to the brain from the muscle and disrupts that pain signal being sent to the brain. Lastly, it boosts endorphins. This is all research. This is all well documented. It triggers a true healing response in the brain, flooding the area, that specific area I'm treating, with endorphins, which are natural painkillers. If your muscles are in constant guarding mode, dry needling helps reset them, breaks that pain cycle, and restores normal movement patterns.
So I can also see those endorphins really helping your mental state and tying in with wanting to just continue doing better and with visualization and all of those things. I just love learning about how it all comes together, and really I'm visualizing exactly how everything works now. And for our listeners, if there is anyone listening right now who may be feeling hopeless about their pain, what's one piece of key advice that you would give them?
I'm going to give you 3.
Okay, even better.
So, I want the audience, I want the patients that are listening, I want the people that are on this podcast to know this. You are not broken. Let me say it again. You are not broken. I don't care how long you've been in pain, how many doctors told you there's nothing more we can do for you, how many times you felt like giving up. Pain is not a life sentence. Your body is capable of healing, of adapting, of finding strength again. Even if it doesn't feel that right now, it's okay. The most powerful thing you can do today, always remember this, believe that change is possible. Because once you do, the way you approach pain, movement, and recovery really starts to shift. You are stronger than your pain. You have more control than you think, and you don't have to do this alone. If this message resonated with you, share it with someone who needs to hear it. Let's break the cycle of pain, hopelessness together.
I love that. I'm going to quote you. You've been very quotable today. So remember, believe that change is possible. You are stronger than your pain. You are not broken. And fear is a liar. And you don't have to believe it.
I love it. I love it.
I love it. I love it. I'm certainly enjoyed this episode so much. I'm sure our listeners did as well. For those in pain, I'm sure that this was very motivational. I'm fortunate to not have any pain right now, but I feel very motivated just because I think these are great mental life hacks, even beyond the scope of being in pain. So thank you so much for taking the time to connect today. This was a great episode. Do you have any other things, any last words for our listeners today?
No, just really looking forward to, the responses, and know that oftentimes when you go to physical therapy, you're there because you think it's just physical, hence the name, physical therapy. But oftentimes, majority of the times actually, it's more than just a physical injury. Most oftentimes, the mental has a huge predictor for your outcome. You want a positive outcome, you have to treat the mind and the body. And we do that at the rehab room.
Absolutely. Mind and body. Well, thank you again. And thank you to our listeners for listening in today on episode 3 of the Rehab Revolution. And we'll see you with episode 4 pretty soon.
Okay. Thank you so much, Leila.